Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. HIV, AIDS, and pregnancy. Introduction. HIV, AIDS is a viral infection. If you have HIV, AIDS, and you plan on getting pregnant or you think you may be pregnant, let your healthcare provider know as soon as possible. Your healthcare provider may want you to change your HIV/AIDS medicine. This is also important to protect your unborn baby from HIV infection. This program explains HIV, AIDS, and pregnancy. It explains what HIV and AIDS are, how to take care of yourself during pregnancy and delivery, and how to care for your baby. HIV/AIDS. HIV stands for Human Immunodeficiency Virus. It kills or damages the body's immune system cells. This destroys the body's ability to fight off infections. AIDS stands for Acquired Immunodeficiency Syndrome. It is the most advanced stage of infection with HIV. HIV most often spreads through unprotected sex with an infected person. This means that it is a sexually transmitted disease, or STD. HIV may also spread by sharing drug needles or through contact with the blood of an infected person. Women can give it to their babies during pregnancy, childbirth, or while breastfeeding. The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go a month or two after a person is infected. Severe symptoms may not appear until months or years later. People who have AIDS have weak immune systems and their bodies cannot fight off diseases very well. Early signs include extreme tiredness and fever. During the later stages of AIDS, pneumonia or cancer may develop, which can ultimately lead to death. There is no cure for HIV/AIDS, but there are many medicines available. These medicines fight both HIV infection and the infections and cancers that come with it. People can live with the disease for many years. Pregnant women with HIV/AIDS can also greatly reduce their risk of passing the infection on to their babies. Prenatal care. Prenatal care is the care a woman gets during pregnancy and before her baby is born. Getting early and regular prenatal care is important for both the mother and the developing baby. It is especially important if you have HIV/AIDS while pregnant. Prenatal care includes health care, education, and counseling about how to handle pregnancy. It will also include care related to HIV/AIDS while you are pregnant. Prenatal care can help keep you and your baby healthy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. It is important that you attend every checkup. Healthcare providers can spot health problems early when they see mothers regularly. Early treatment can cure many problems and prevent others. Healthcare providers also can talk to pregnant women about steps they can take to give their babies a healthy start to life. A blood test can tell if you have HIV infection. All pregnant women should be tested for HIV early in the pregnancy. Special precautions may need to be taken to protect your baby. It is important to talk to your healthcare provider about anti-HIV medicines. Taking these medicines during pregnancy can help prevent the spread of HIV to your baby. Usually a combination of at least 3 different anti-HIV medicines is given. Some women may not need to start taking anti-HIV medicines right away. Talk to your healthcare provider about when you should start these medicines. Some anti-HIV medicines can harm your baby. If you are already taking anti-HIV medicines, talk to your healthcare provider. He or she may want you to take different medicines or change the doses. You should also ask about the ways you can prevent the spread of HIV to your baby during delivery. The next section will talk more about this. but it is important to have a plan in place before the baby is born.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Delivery. HIV can spread to a baby at any time during pregnancy and cause an infection, but it often happens just before or during delivery. The baby comes into contact with the mother's vaginal fluids and blood during delivery. HIV can spread through these fluids. A baby is more likely to be infected with HIV if the delivery takes a long time. Babies are also at higher risk if the mother has a high viral load at the time of delivery. Precautions can be taken to prevent the spread of HIV to your baby. Anti-HIV medicines taken during the pregnancy are continued through labor and delivery. Another anti-HIV medicine can be given intravenously during labor and delivery as well. If the mother has a high viral load, a C-section may be done. A C-section stands for cesarean section. It is when the baby is delivered surgically through an incision in the mother's abdomen. A C-section keeps the delivery time short. This reduces the risk of passing HIV to the baby during delivery. But like all surgeries, a C-section comes with risks. Some of these include blood clots for the mother and breathing problems for the baby. A C-section does come with extra risks for a woman with HIV-AIDS. HIV-AIDS makes the immune system weak. This means that it is easier for women with the virus to get an infection after a C-section. Antibiotics are often given during surgery to reduce this risk. If a woman's water breaks before a C-section, the C-section may not reduce the risk of HIV spreading to the baby. If this happens, your healthcare provider may then decide that a vaginal delivery is the best option. Caring for your baby.
Babies born to mothers with HIV/AIDS should be given anti-HIV medicine soon after birth. The medicine is usually started within 6 to 12 hours of delivery. Your baby may continue taking medicine for 4 or more weeks. HIV testing will be done multiple times during the first 6 months to see if your baby has the infection.
To test for HIV, a blood sample will be taken from your baby. The test looks for HIV in the blood.
To be diagnosed with HIV, a baby must have 2 positive tests. This means that 2 tests must find HIV in the blood sample for the baby to be considered HIV-positive or infected with HIV. To know that a baby does not have HIV, the baby must have 2 negative tests. The first test must be done at 1 month of age or older. The second test must be done at least 1 month after the first test. If a baby does have HIV, a second medicine is started at 4 to 6 weeks of age. This medicine prevents a type of pneumonia that is common in people with HIV.
HIV can also be spread through breast milk. Mothers with HIV/AIDS should not breastfeed their child. Formula may be used instead of breast milk. Rarely, the virus may spread through food that was pre-chewed by someone with HIV/AIDS. Mothers with HIV/AIDS should avoid giving their baby pre-chewed food. Caring for yourself. After birth, it is also important to care for yourself so you feel well enough to take care of your baby. After your baby is born, talk to your healthcare provider about how to control your HIV/AIDS. Your healthcare provider may stop or change your medicines after your baby is born. This depends on many factors, such as if you can take the medicine exactly as directed, your preferences, your viral load, whether or not your partner has HIV/AIDS. Never stop taking your anti-HIV medicines until you talk to your healthcare provider. Stopping medicines may limit the number that work for you. It can also make your HIV/AIDS infection worse.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. If you have HIV/AIDS, let your healthcare provider know as soon as possible if you are planning a pregnancy or think you may be pregnant.
Some HIV/AIDS medicines may harm your baby. Your healthcare provider may want you to take different medicines or change the doses. It is also possible to give HIV to your baby. This is most likely to happen around the time you give birth, but it can also happen during pregnancy or if you breastfeed your baby. Several treatments may prevent the HIV virus from spreading from you to your baby. Your healthcare provider can recommend the best one for you. All babies born to mothers with HIV/AIDS should be given anti-HIV medicine soon after birth. The medicine is usually started within 6 to 12 hours of delivery. Your baby may continue taking medicine for 4 or more weeks. If a baby does have HIV, other medicine may be started. Your healthcare provider may stop or change your medicines after your baby is born. Talk to your healthcare provider about how to control your HIV/AIDS. Never stop taking your anti-HIV medicines until you talk to your healthcare provider. Thank you for using Explain.